This is Beverly of Miles and Coffee. And as you can see, we have a very, very special guest. So get your favorite brew. You know, we like to have coffee. And today's topic is choosing the right expat insurance. And we have a specialist who has decided to give us very good information today. Welcome my special guest, Antonio Trejo.
Yes,
how are you, Antonio?
I'm doing fine, thank you. How are you, Beverly?
I'm doing well. I hope you have your coffee.
I have it right here.
Cheers. Excellent. Very good. Thank you, Antonio, for agreeing to this interview today so that we can give our viewers accurate and up-to-date information to help them make their choices. This is one of the #1 questions that we get on this channel. And I, too, am in the process of choosing based on wonderful quote that I received from your company. So thank you. We're going to start off with the first question is, can you tell us more about you and what you do at Guardian Expat Insurance?
Okay, yeah. Well, as you said, my name is Antonio Trejo, and I'm an insurance broker in Mexico. I've been doing this for almost 11 years. I started when I was in college, and this was a job to pay for my college. But then as I was learning more about the industry, I realized how big and important it is. So ever since I started in the business, my area of expertise became health insurance. So I've been helping expats for about a decade with their insurance needs. My specialty is health insurance, but the company, Guardian Insurance, MX, is an insurance brokerage firm that offers all types of insurance products and services for expats and digital nomads. So the company, the agency, offers auto, whether it's Mexican plated or foreign plated, property, whether it's a condo unit or a standalone unit, boat, travel, medical evacuation, buildings insurance, business insurance, and health insurance, of course, like I said, is my specialty and that of a lot of people in the team. Guardian Insurance has 2 offices, one in Mexico and one in the US, but we have agents that represent us in different cities of Mexico. That includes Mexico City, San Miguel de Allende, Querétaro, Playa del Carmen, Los Cabos, Tijuana, Guadalajara. So in Puerto Vallarta, of course, is where we have the headquarters of the company. So it's not just me, but in total, it's a team of about 20 people that are half of them in the office and the other half spread in the different cities of Mexico that I mentioned. And so the company, what we do is, well, we have expats on staff. So that helps us a lot. We were able to better understand what the needs of the expat community are. And everybody that interacts with clients is bilingual, so that, you know, there's no loss in translation issues when buying a policy and not knowing that, or thinking that you bought something and end up buying something else. And I think what's been a game changer, and one of the best and most competitive advantages that we have, is that we have our own in-house claims department. So I want to give you a little more context about that so that people know how important it is. Insurance anywhere in the world is difficult, right?
Yes.
It's a very complicated industry, but it's one of the most important. It gives stability to so many things, right? But it's intangible. You don't see what you have until you use it. So that's why it's a bit difficult. And when you come to Mexico and your first language is English, even if you're fluent in Spanish, insurance is a different language itself. So even if you're fluent in Spanish, you're not fluent in Spanish in insurance, right? And insurance doesn't work the same way as it does in the US or in Europe or in Canada. So with all the things being mentioned, having an in-house claims department, the idea is to help clients when they're using their policies that they follow the steps established by the insurance company, and they submit things in the proper way, so that we make sure the clients receive the benefits they are entitled to. So one of the things in our experience, we've seen that probably about 40 to 45% of the bad experiences that people have using insurance could have been avoided if their brokers had stepped in and had helped them, had provided guidance, and assistance. So that's what our in-house claims department does. Whenever a client needs to use their policy, we will say, hey, Beverly, okay, so you need to use your policy. These are the things you need to do. Help us, please follow these steps. Please provide this information. We'll take care of the rest. That way, we make sure the clients receive what they are entitled to, and there's nothing that trumps the way, or there are no bumps in the way. So in the insurance companies respond in a timely fashion, and clients are happy, and etc. Of course, there will be cases where claims have complications because it's part of the industry. It's natural, but we try to mitigate that as much as possible by having people that assist clients when they need to use their policies. So that's a little bit about Guardian Insurance. I don't know if that answers your question.
Yeah, well, that is very impressive, Antonio. Very
Thank
impressive. You. So congratulations on your 10 years of success. And also the fact that I'm impressed with the offices in Mexico and US. Yes. And that you just explained all types of insurance. So we are really, really considering ourselves lucky to talk to you, because you are the CEO of this wonderful company. Well, when we're talking specifically about expats and expat health insurance, why should expats choose Guardian Health Insurance?
Okay, thank you. Well, that's a good question. I would say that, well, there's hundreds of agents. Actually, there's thousands of agents in Mexico. Throughout Mexico, there's thousands of agents, but really agents or agencies that have a structure that can suit the needs or meet the needs and expectations of foreigners, very few. It's really challenging for us as agents to create an entire structure and a company that can have bilingual people, that can have documents in English, because most insurance companies in Mexico, their official documents are issued in Spanish because that's the official language in Mexico. And they have to comply with the laws in Mexico and the requirements established by the insurance authorities. So very often we receive clients or expats come to our office. There are clients of other agents, but they don't understand what they have, because the policies are all in Spanish. The agents speak very little English, and it's hard to understand them. It's hard to explain this industry if you're not bilingual. So everybody that interacts with clients, with expats, is bilingual in the company. Like I said earlier, we have a couple of expats working in the office and in general for Guardian. So that helps us a lot. We translate whatever is provided in Spanish by companies, we translate it to clients, right? We explain. So one of the things we do a lot is when people, expats, ask for a quote, we will send them a couple of options based on what their needs are. So we ask specific questions to try to understand what they are looking for. Then based on that is what we send. And I think one of the things that we've done that has been a key to our growth and success, it's that rather than selling a policy, we address the questions of the clients.
Okay.
So I think our company is more of it's more aimed towards the customer service rather than the sales strategies. So clients come, expats come and say, hey, I need a policy that can cover me in Mexico, but you know what? I also go to Italy or to Europe a couple of times a year, and I stay there for a couple of months each time. Or I split my time between Mexico and the US. What can you offer me that suits those needs? So we will address those questions and concerns. We will provide the prospect with the information they are asking, and we'll make sure that they understand what they are going to receive from the company, the insurance company, and from Guardian before they pay for anything. So I think those are things that clients appreciate. And I think that's been one of the keys to our growth and success, I would say.
I agree with that. And I have to just interject here about the documents being in English. I have had insurance before, and it was really a hard experience for me because the documents were not in English. And every time I had a question, I had to go to a translator. That was additional cost. I still didn't understand what I had. And I felt at the end of that term, at the end of that year, not to renew and start to look elsewhere. I'm also really, really appreciating that Guardian is more customer-centered, customer-oriented, rather than sales-oriented. I really like that. Now, the reason why I'm having you, Antonio, explain is because I'm interested in Bupa, National, Vital, but instead of my viewers asking me, well, Beverly, what about your insurance? I know that the quote was specific for me. And so I would like for you to tell us in general an overview, because my experience and my quote would not fit everybody. So
exactly.
Can you please explain the benefits of Bupa National Insurance, or Bupa National Vital?
Okay, yeah, sure. And what you said about quotes are not, so a quote for you will not be the best option for someone, say male, someone in a different age bracket, someone that travels a lot to the US, someone that's looking for maternity coverage, someone that lives in Mexico City, or someone that lives in Puerto Vallarta, or someone that lives in another state or city. So there's I really appreciate this interview because there's so many Facebook groups of expats throughout Mexico where you see so much misinformation. So many social media experts, I call them social media experts because only on social media are they experts. You know, I see so many, and at times I've tried to share my knowledge with the audience or followers or members of a Facebook group. And very often I come across people that really, they don't know what they're saying. They don't know what they're talking about. And that creates misinformation. And then we have a lot of people asking us a lot of questions that are more concerns that arose from reading all those comments and all those all that misinformation on social media. So I hope that this interview is shared with as many people as possible, because that way they will receive accurate information from some. So if I need cooking advice, I'll go to talk to a chef. You know, I will talk to an attorney. You know, if I want to know where to go on vacation, I'm going to ask probably someone. Or if I'm planning on going to a certain city, I'm probably going to ask someone who specializes in traveling, or has a travel agency. I don't know. I think people should talk to those that specialize in the industry of whatever product service they're seeking. So going back to your question, so the products that we have, the companies that we work with, in the division of health insurance, because as a whole, we work with about 20 insurance companies, but for health insurance, we work with about 6 companies. So, but we don't send the options on those 6 companies to every person that reaches out, because like I said, based on the needs of that one person in specific is what we're going to send, right?
Okay.
So in your case, based on the information you provided, the broker that contacted you with the quotes found those 2 options or those 2 companies as the best ones for you, right?
Yes.
So that plan that you're leaning towards, the Bupa and Nacional Vital, so it's a plan recently launched by Bupa. Okay. Bupa is Bupa is the world's largest health insurance provider.
Oh.
They are headquartered in London. They have a portfolio of around $7 to $8 billion. They have their own hospitals in many parts of the world. In Mexico, they just bought a couple of hospitals. They plan on expanding like that. They have offices in about 195 countries, and they are really huge. I've been to London, and I've seen their offices. It's shocking. It's mind blowing. It's breathtaking, and it's great. And they in Mexico, of course, they have offices as well in different cities, right? So in Mexico, ever since they started business in Mexico, they've specialized in the high-end market of Mexico.
Okay.
In Mexicans that have a really high, that belong to a high exclusive community or exclusive group of people that can afford policies that are quite high in price, but that also provide the best of the best. These are usually people that want coverage in the US, that want the best benefits, the best hospitals on the market, etc. And they've been doing that for many years. But about a year and a half ago, they launched this product that we shared with you that has an affordable price and good benefits. So cost benefits wise, it's a good deal, and is meant to the mid-class market in general, Mexicans and foreigners, that it's not gonna impact their pocket a lot. It's gonna give them good benefits so it's a good deal in all
it's
kinds of ways.
affordable. It is very affordable. Mm-hmm.
Yeah, and what makes it really attractive is that so far that plan is the only plan on the market with zero deductible and zero co-insurance and direct payment. So
that's what I was shocked when I saw zero deductible. I had to read that twice.
Yes. So most plans of the many companies on the market will have deductible, co-insurance, and they have direct payment, but they also have reimbursement. In this case of this plan, there's no reimbursement option. There will be reimbursement in very specific cases, very specific scenarios, but the idea of Bupa with this plan is to make it direct payment, 100%, that you go to the hospital, you show your card, or you give them your policy number, and that you don't pay a dollar, that you don't pay a cent, that you want to see a doctor, you go to the doctor, they see you, and they bill Bupa directly. You need medication, you will get it through the hospitals or through the pharmacies, the drugstores that they have an agreement with, and you won't pay anything out of your pocket. So that means you won't have either any hidden fees, that nothing, no surprises there. So that's their goal, and I think it's good that the difference with the other plans that we shared with you is that this plan has a network of hospitals and doctors that you have to go to in order to use a plan, whereas the other ones have free choice of doctors and hospitals. So both plans that we sent you, both companies have, I would say, pros and not pros and cons, but their own exclusive benefits, and their advantages and their disadvantages. So with Bupa Nacional Vital, you have to go to the hospitals of the network and see the doctors at those hospitals and see and buy your medication through the pharmacies and hospitals they have in the network. Or if you need lab work done, you have to go to the clinics that are in their network. Whereas with the other plan, you don't have to worry about any of that. You want to go to X or Y hospital, you go there. There's no penalty in any way. There's no, so with Bupa Nacional Vital, if you go to a hospital that is out of the network, there's no coverage.
Oh,
right?
got it.
Whereas with the other company, if you go to any hospital, really, there's coverage. If you go to any doctor, whether they work at the hospital or not, if you go to a pharmacy, whether it's part of the network or not, there's nothing to worry about as far as will this be covered, will this be denied by the company. So they're both, I would say they're both really good. They're both, I think they're the most preferred plans on the market by people. But being specific with your plan, those are great. The things I mentioned are really appealing. They're really attractive to people.
Excellent.
And they have a guaranteed renewal for life. So you don't have to worry about being canceled, after a certain age. So I think that's really good.
I love that. And so just to clarify for the listener, we were comparing Bupa National Vital with Vumi.
Mm-hmm. Vumi
and
expat.
So Vumi is the one where there's more hospitals. Is that what you're saying?
Yes, there's more. It's a free choice of hospitals and doctors. And this plan with Vumi, you have automatically at no extra cost coverage all over the world, excluding the US. Whereas with Bupa, you just have coverage in Mexico. So those are. So the reason why Vumi covers everywhere in the world, excluding you can include the US at an extra cost, but the plans that you received exclude the US. The reason is that healthcare in Mexico, major medical expenses in Mexico have become among the highest in terms of cost in the world.
Yes.
So in the continent, in the Americas, Mexico is so far the third most expensive country on healthcare.
Wow.
So number one is the US, that's number one all over the world, right? Number two is Brazil, and number three is Mexico. So,
I didn't know that.
Yeah. So facing a major medical event is extremely expensive in Mexico. It's nowhere near as expensive as in the US, because there's no place in the world that has a healthcare as expensive as the US. But that doesn't mean Mexico healthcare is cheap. Not being as expensive as the US does not mean it's cheap. Those are two different concepts. So when insurance companies cover expenses in Mexico, they're happy to cover expenses in Germany, in Asia, in Africa, in Costa Rica, in Spain, because very often it's less expensive for them to cover expenses in those countries than it is in Mexico.
Wow. So the misconception for us foreigners is that health insurance is very cheap in Mexico.
Health insurance and healthcare, yes. So I will say health insurance is still really affordable. If you think about the risk exposure of your pocket and your financial stability, if you don't have insurance. So for example, people tend to compare the cost of insurance with the cost of seeing a doctor's visit or medication or an MRI or x-rays or a minor surgery for that matter. But nobody really cares about, or nobody really buys insurance to cover a doctor's visit or to cover an MRI. Not even nobody. No, I'm not talking about just foreigners or expats. I'm talking in general, clients, people in Mexico, Mexican citizens. They don't buy insurance for a doctor visit or for an MRI. They buy it for the big things that we're all exposed to that. You never know. It's a roll in the dice, so you never know. But a heart attack can go from $45,000 to $100,000 if you pay out of your pocket with no insurance.
Right.
So that's just talking about the stabilization expenses, right? So if you needed an open heart surgery, that's we're talking about even higher numbers. If it's a cancer on average, it's around $120,000. So maybe that cancer in the US is $1 million. And when you compare the two, you say, well, it's way lower in Mexico, but that doesn't mean it's cheap. I don't know anyone that has $120,000 just laying around to be spent all at once in 1 year with cancer treatment.
Right.
So when you think about those costs, we had a case of someone that had a problem in the kidneys, and he went to the hospital. Then he developed sepsis in the hospital, and the bill total was close to $200,000 for like 2 weeks or so. So all of that, when you think about that and you see a policy that is going to cost you, depending on your age and the plan that you choose, can cost you $1,000 a year or can cost you $10,000 a year, really is nothing. Because you will be paying those $1,000, $2,000, $3,000, $4,000 a year throughout the course of many, many years. Whereas if you don't have insurance and you have a heart attack, you'll be out easily $30,000, $40,000 in 1 week. So yeah, so things to think about, the misconception that healthcare in Mexico is in general cheap is nothing further from the truth. That's why you see also, for anyone that is going to watch this video that belong to Facebook groups, when you see expats running a GoFundMe campaign, very often is because they didn't know how expensive it was going to get until they were already facing that situation. So in the many years that I've been in the business, hundreds of expats have come, received quotes, they left, and then they reach out months later wanting to get a policy at that moment because they've been diagnosed with cancer, because they're in the hospital, because they just had a really bad accident and it's going to cost them a lot of money. At that moment, it's already too late. You don't get insurance. You don't get car insurance after you hit another car. Same way you don't get health insurance when you've been already diagnosed with something and expect the company to cover. That's not how it works. So people running GoFundMe campaigns is because they don't have enough funds to cover for, cancer, stroke, a heart attack. So all kinds of things. So that's if people really call hospitals, I will encourage all expats that are going to watch this video to reach out to hospitals. Google the cost of healthcare in Mexico. You're going to find accurate information, not the testimonial from another expat that has never had a big incident. That so many people say, hey, I've been here for 5 years. I've been living here for 10 years. The most I've paid to a hospital was $2,000. Yes, because you were probably just having a nice surgery, Right. Or maybe you had a hernia and it was minor and it was an ambulatory surgery and you paid $2,000. But have you had cancer? Have you dealt with a heart attack? Have you dealt with a big drastic accident? Have you been diagnosed with kidney problems? Have you had organ transplant, open heart surgery, a tumor? Any of those things? Have you dealt with those? And did you spend $2,000 on that? That's not true. So that's why we encourage anyone, if you can afford insurance, it's an investment, it's protection, it's peace of mind. So that's what I can say about that.
Thank you. This is an investment, and you gave some great analogies about the fact that this is preventative. You don't wait until the situation is upon you to get what you need. You get it before the fact, and you do your research. And I'm just going to say, like you said, there's so many specialists or experts that are on these groups that I tend to avoid. I go to the source, and I always recommend my viewers, please do your research and go to the source. And in this case, we're bringing the source to you. So speaking of hospitals, Antonio, can you please share a little bit of knowledge about what should we know about hospitalization in Mexico? Sure.
So this is linked to what I was saying about the cost of healthcare. If you have a stomach ache, if you're having breathing problems and you think it might be something bad, and you go to the hospital at 11 a.m., the cost of a doctor in the hospital admitting you to the hospital will be different than if you go at 11 p.m., for example. Prices are different if you go to the emergency room in the morning than if you go at night or if you go on the weekends, because doctors will charge more, hospitals will charge differently, nurses will charge differently. So that's something also to take into account, that you can out of your pocket, you can spend $4,000 in one day if you showed up at the hospital at 1 in the morning or 2 in the morning with what you thought was something critical, was something really bad, and it ended up being just maybe food poisoning, but you thought it was something else, and you're discharged, but you had to pay $4,000 because
Up
you spent
upfront, not
because,
installments.
Yeah, because you went on a Saturday at 2 in the morning, you made the doctor go see you, you made the nurse stay longer, you made the hospital open their emergency care center, their emergency rooms, and whether it was bad or not, what happened to you, the cost of the service will be more expensive because of those reasons than if you go in the morning, go see the doctor at 1 p.m. and say, hey, I have a horrible stomachache. I don't know what it is. They check you, they run some tests, and it's just food poisoning. That's probably going to be $300, $400, So that's something people should know. Also, whether if you carry insurance, whether you have company A, B, C, all the way to Z, it doesn't matter. When you're admitted into a hospital, you have to leave a deposit, regardless of the company that you carry. That is a hospital policy, not an insurance company policy. So even if such hospital works with the company that you carry, they will still ask for a deposit because they don't know if what's happening to you is covered by your policy. They don't know if you have a deductible to meet. They don't know if that condition is covered up to a limit. So for so many reasons, a hospital needs to protect themselves and say, okay, so you're coming here with COVID, real bad. So, and your company is paying for it, but still you need to leave a deposit of, and will vary depending on the severity of your condition. So if you go there with a heart attack, with a stroke, whoever leaves the deposit is going to be higher than if you go there with a small fracture. But no matter what company you carry, a deposit will be required by the hospital, right? So also, private insurance gives you access to private hospitals. Right. So people need to understand this too. Like there's so many people, so many experts that think that the IMSS, which is the public healthcare system, or the Seguro Popular, that's what they're going to get if they get a private health insurance policy. Or they think that the public healthcare system gives them access to private healthcare system. In certain circumstances, that's not the case. You want private healthcare, you need to have private insurance or pay out of pocket. You want public healthcare, it's very easy to enroll. You still have to pay a fee for one of those public healthcare systems. For the other, you don't pay a fee. But of course, anything that is cheap or free has its flaws. So there's a video on our Facebook page where I talk about the four healthcare systems in Mexico, 3 run by the government, so 3 public healthcare systems, and 1 private, that is, private hospitals. So private health insurance gives you access to private hospitals.
We'll leave the link to your Facebook in the pinned comment below so that people can watch that and right after this. So thank you for mentioning that. And of course, you'll send me that link and I'll be glad to put that in. Listen, what else? Is there any other information that you feel is important for those of us that are looking to get health care or health insurance as we become expats in Mexico?
Yeah, I think people should really, expats should really get informed, like you say, and you encourage people on your channel, go to the source, make informed decisions. And if you decide not to get insurance, just be aware of what you're exposed to, right? So if I choose not to pay for insurance and I'll just take my chances, I just have some money there, put aside a good amount of money, because you don't know, maybe nothing's going to happen. We have clients that have been with us for 5 years. They've never used their insurance, but we have clients that buy their insurance and 2 months later they use it. So you never know. So if whether they choose to purchase insurance or not, being prepared for the unexpected, I think that's going to avoid or prevent expats from having their dream trumped, the dream of living in Mexico trumped by, a bad decision, an unwise decision, I would say too that they shouldn't determine whether a company is good or bad based on the price. That happens very often. We have expats coming to us saying, hey, you know what, my policy is horrible. Can you offer me something better? And when we look at the plans that they are carrying, turns out they carry a great policy in terms of benefits. Mm-hmm. So when we say we can offer you something less expensive, that's what you're asking, but something better, we think honestly that what you carry so far, even if you're not our client, is really good. What you're paying versus what you're getting is a great deal. If you want something less expensive, we have it. Just be aware that you're giving up these benefits. At the same time, we have clients that have been with us for years and they say, hey, can you offer me something better? I can't afford this. Oh, you mean something less expensive? Sure, we can offer you something less expensive, but just be aware that you're giving up many things when you decide to reduce the cost of the policy. So compare options, compare benefits, talk to the broker, make sure the broker addresses all of your questions and concerns.
Yes.
And make sure that you're asking the right questions. Are you asking the right questions? What are you asking? Are you asking about the price? Is that what you're asking? That's not the right question. It's a good question, but it's not the right question. The right question is, where is this company headquartered? Who regulates these companies? How many years have they been on the market? What is their network of hospitals and doctors? Do they speak English? What if something happened to me overseas? What's their coverage process like? What's the claims process like? Do hospitals accept payments from this company? How many clients do you have with this company? Those things are the right questions. And then you ask those questions and you compare the options, and then you decide what you want, what suits your needs. But again, now you are aware of what you're getting before you make any payment, before you purchase anything. I think that's the best thing that someone can do with regards to insurance and healthcare in Mexico in general.
Exactly. I totally agree that it's all about the best benefits for your buck, not necessarily the cheapest, the best benefits. Well, listen, how can people contact you if they want to ask for a quote?
So the best way to get a hold of us is by visiting our website, guardianinsurancemx.com. And we have a Facebook page too with the same name, Guardian Insurance MX, and an Instagram page, Guardian Insurance MX. They can email us at contact@guardianinsurancemx.com. Or any of our numbers that are on the website, either Mexican line or US or Canadian lines. So we also have a chat. So there are many ways they can get a hold of us.
Excellent. So you're on Facebook, IG, and your website, and they can email you as well. For my listeners, thank you, milers. If you have made it to the end, you are a true miler, because you know that I will leave all of the information, the contact information for the company in the pinned comment below. And also, please leave a comment in the comment section, because I'm pretty sure that Antonio would love to see your comments as well. So do you have insurance? Are you in the process of seeking insurance? What questions do you have? And I will leave the last word for you, Antonio.
No, well, I really appreciate this. I hope many of your viewers and followers can watch this video and learn a lot. I think now that we're having so many foreigners moving to Mexico, they're going to have the need of reliable information and sources of reliable information is more important than ever before. I will say, it doesn't have to be Guardian. There's a few other brokerages out there that also specialize in expats. Just make sure they do you do due diligence as an expat yourself, but also that you feel comfortable with the service that you're receiving from the brokers before you purchase anything. If you feel good with the service they're offering, you're probably going to feel good when you need to use the policies they recommended, they suggested, the policies you bought from them. And I look forward to doing another interview with you in the future. We can talk about other topics. I mean,
we need to do another one because you do so many different types of insurance that I wasn't aware of. So we definitely, I'll contact you because I'm interested in hearing even more about the other types of insurance and just healthcare in general. But this has been absolutely perfect. So don't forget to hit the like button if you've heard something that you appreciate today, and leave a comment below, okay? And we always say, take it one day at a time and keep it simple, my friends. Ask good questions when you're getting your answers about health insurance and healthcare. Until next time.
Bye. Thank you.
Thank you for joining me today on Miles and Coffee.